Good evening to all the alumni in this room and to other ladies and gentlemen who may not be nurses. We could probably do a straw poll, and I suspect that we non-nurses are definitely in the minority tonight. I'm Paul Roberts, and I'm the curator of the Museum of Healthcare, which is directly across the street. There's a delightful view just through that window. I've never seen it from that angle. It's really nice to be part of it. Of course, tonight we're here for our Dr. Margaret Angus Research Fellowship Evening, which is an annual event we are proud to host every year. For those who don't know, of course, if you're Kingstonians, you'll certainly have heard about Dr. Angus over the years. She was a noted Kingston researcher and historian of many historical publications, and certainly a promoter of built heritage. She was also a founding board member at our museum, and of that connection we're very proud, and certainly a good reason why was selected as the Margaret Angus Research Fellow is selected annually by the museum from a pool of qualified candidates, including new scholars, senior undergraduates, and graduate students. The appointed fellow spends the duration of the 16-week program researching and preparing a manuscript reflecting the history of health and health care. Topics are often inspired by artifacts in our collection, and of course, as a major part of this, apart from producing your final manuscript, is delighting people such as yourselves at an evening lecture usually held in October. Please join me in welcoming our Margaret Angus Research Fellow for 2008, Andrea Melvin.
Well, it's my pleasure to be here tonight. It's actually an honor to be here. As Paul mentioned, I was thrilled when I found out that Dr. Margaret Angus had an interest in costume, so that was one of the reasons why I was really keen to do a topic of this nature. And I became interested in the area of nursing history after working on a project in my master's program at Western. As I got deeper into my project here at Kingston, I was amazed with the emotions that the nursing uniform evoked. When I told people what I was studying, everyone seemed to have an opinion, as the nursing uniform had touched them in some way, due to its associations with the nursing profession, or they just couldn't believe the fascinating history that the uniform had. And these are just the main points I will cover in this talk. From the period of 1930 to 1970, which is the focus of my study, nursing uniforms offered greater mobility for young women living in rural areas of Ontario and other parts of Canada. So this is the first style of KGH uniform here. It was created in 1886. Following this, it underwent 6 major changes in design throughout the 20th century, for some stylistic but mainly pragmatic reasons. The early uniform, introduced in 1886, required a corset and layers of petticoats that were acceptable mode of dress in 1906. Again, now I have a picture up here from 1911 because that was the best picture to show that would demonstrate this new style in uniform. So by 1906, the sleeves again took on a style of the period. This is the mini. I'm sure you all know it. 1967 saw the most dramatic change to the uniform. A short, one-piece, A-line design with 2 rows of buttons down the front. So creating a ladylike image for nurses was crucial for this, and was no more evident than in a fictional tale that was published. This is something I'd come across in my research. This was published in 1884 about a respectable man who had a crush on a nurse, and how unacceptable this was for the period. Over the years, hospitals evolved, obviously, and improved, and the enrollment in hospital schools at KGH, the need for a nurse's residence was probably one of the first signs of the growing school. So the KGH's residence, known as the Nurses' Home, was built in 1904. The building became the Anne Bailey Residence in 1942, following the death of the much beloved superintendent of nurses, Anne Bailey, who was at KGH from 1924 to 1942. The uniform was the visual reassurance of upward social mobility that KGH nurses passed down from one generation to the next, and continued to attract students to the school. Many students put their heads down and worked through the rigorous training process, for as they knew, or quickly found out, the alternative option for work might mean factory or manufacturing work, both of which were becoming occupations for women in Ontario. In 1952, as seen in the yearbook, this look was still thought to provide an obvious indicator of a nursing student's skills to both doctors and the public. The words of one student as she moved into her whites demonstrates this. She said, "Yesterday, the doctors ignored me. Today, they want me to remove sutures. Yesterday, the patient's relatives thought I was the maid. Today, they are asking my advice on matters far beyond my experience." The uniform confirmed the highly valued attributes of discipline and reliability, which enhanced the nurse's employment. Now, this writer also had said that they wanted a fine if they saw anybody wearing a cap and uniform that didn't deserve one. But the uniform's ability to exercise control and gain respect was the reason for its success among nursing students. The committee, which dealt with the changes in the uniform at Kingston General Hospital, faced a number of objections in changing the traditional symbolism representing the uniform. These complaints came from those who knew the uniform best. It was the students and the alumni. With the transformation of the nursing education, which eventually had led to a complete move from hospital-based training schools to colleges and universities, the uniform became part of the overall makeover of nursing education. In just a few years, colleges and universities stopped practicing symbolic nursing traditions as hospital-based training schools had with their uniforms, caps, pins, badges, and they eventually became completely phased out. As a result, new generations of student nurses could not relate to their use, and in the importance of nursing symbols weakened. Nurses have since begun to dress like other healthcare workers, mainly wearing the more casual scrubs, in which comfort and functionality are the most important reasons for wearing this dress. How nurses should distinguish themselves is part of a larger discussion today amongst hospitals across the country, and something that maybe we could talk about a bit later. The difficulties that have arisen from modern day historical perspectives are that they often assume that all women in the past were victims of their restrictive garments. Dress was an important part of nursing practice and a powerful tool by the women who used it. Only by paying close attention to the personal meanings around the garments themselves can we know the expressions of identity, personality, and aspirations that the uniform offered. The uniform collection at the Museum of Healthcare provides compelling evidence about the role of hospital nurses. It reformulates commonly acceptable perspectives, such as nurses being purely victims of sexism and discrimination in a male-dominated healthcare system, with their dress as just another component of this exploitation. I think instead of being considered a device of control, the nursing uniform should be placed prominently on display where we can all enjoy it as an artifact that furthered women's place in Canadian healthcare. So that's the end of my talk. Did you have any questions that you would like me to answer?